Hello and welcome to Health and Wellbeing on ASO Television. I am Lois Abasambu. The liver is a vital organ that processes nutrients, filters the blood, and fights infections. When the liver is inflamed or damaged, its function can be affected. Inflammation of the liver, also called hepatitis, can be caused by heavy alcohol use, toxins, some medications, and certain medical conditions. Well, today on the program, we will be discussing viral hepatitis in Nigeria and how this can be eliminated. Our guest today is Dr. Chike Bosa, who is a public health practitioner, and he joins us on the program today. Dr. Bosa, you're welcome.
Thank you.
And it's nice having you here.
Same here.
Well, we're going to go on a short break, and when we return, our discussion will commence. Do stay with us.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman 0803 705 1784 or Dr. Doris John 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
Welcome back, and thank you for staying with us. Before we went on the break, I told you that Dr. Chike Bosa is here with us to discuss viral hepatitis and how this can be eliminated in Nigeria. So straight to the discussion, Dr. Chike. Like I said earlier, viral hepatitis is the inflammation of the liver.
Yes.
And while growing up, I knew of two types of hepatitis, hepatitis B and hepatitis C. I think at a point I was diagnosed with one, but I can't even remember which one. But I'd like you to actually tell us the different types of hepatitis and how they're contracted.
Okay, so the different types of viral hepatitis. So because when you talk about hepatitis, there are different other causative agents for hepatitis in general. So like you said, hepatitis is the inflammation of the liver, not minding the cause anyway. So but we're talking about viral hepatitis, which is the most common, like, it's very common to have viral hepatitis, the reason why there's inflammation of the liver. So for viral hepatitis, we have a lot, there are a lot, not like we have a lot, but we'll be talking about 5 major types. That's type A, type B, type C, type D, and type E. So these ones are widely studied and it's common, so that's why we're giving more importance to it. So type, like you mentioned earlier, let's start with the one you mentioned, type B. So type B is the one most people are familiar with. So most people assume hepatitis is hepatitis B.
Once they say hepatitis, it's B.
Yeah. So, but actually that's type A. So type A is a form of hepatitis which is gotten through ingestion of contaminated food or water. So it's more like fecal oral route. So it's what you put in your mouth, and you could ingest the virus in the process if the food or whatever you put in your mouth is contaminated. That's type A, hepatitis type A. So for type B, it's gotten mostly through sexual transmission and also blood. So blood contact, take for example sharing of needles, fluid, body fluids generally.
So they said you shared spoons or something.
Yeah, you get more of type A.
Oh, from that.
Yeah, type A and type E. That's what we're coming to. So you really do not get hepatitis B from sharing with spoons or hepatitis C, except there's a body fluid involved in that sharing. Take for example, of course, if someone is bleeding and you're sharing a spoon with that person, so of course there's body fluids involved. So hepatitis B is more, it's commonly gotten through sexually transmitted, and as well as body fluid, so blood or anything that makes you come in contact with an infected body fluid. So hepatitis B is similar as well, but it's more commonly transmitted by body fluids as well as sharing needles, and it's less common to be transmitted via sexual intercourse.
That's hepatitis C?
Yeah, that's hepatitis C, although it's also still being transmitted via sexual intercourse, but the chances are lower than hepatitis B. Yes, so it's still, like I said, body fluids still for hepatitis C. So other body fluids, but mostly body fluids lessly transmitted through sexual intercourse. So hepatitis D, it's more concurrent. So once you have hepatitis B, it gives room for an infection of hepatitis D. So most of the time, for you to have hepatitis D,
you must have had hepatitis B.
You must have had hepatitis B. So this infection coexists most of the time together. So for hepatitis E, similar to hepatitis A, is more fecal oral route. So it's more like what you put in your mouth and contamination of food, drink. So that's for hepatitis E.
Okay. So for hepatitis that is sexually transmitted, and also, like I said earlier, it's caused by excess alcohol. Which of the hepatitis is gotten through that? Like excess alcohol, sometimes they say drugs and toxins.
Okay, so when you talk about drugs can cause a form of hepatitis, meaning the effect of the drugs on the liver. Hepatitis is basically a disease of the liver, all right? So alcohol is also a form of drug abuse that could also have an effect on the liver. So these ones are other causative agents. They are not viral causes. Do you get?
Okay.
So viral
causes...
they're not
viral hepatitis?
Yeah, they are not viral hepatitis. Viral hepatitis is the one I ran through hepatitis A to E.
Yeah.
So the other ones are also causes of hepatitis, but not viral causes. So I don't know. Let me break it down a bit more
so that we can understand.
So you can understand. So okay, there's a liver, right?
Yes.
So this is an organ. The liver is the largest internal organ in a human being. So there are certain things that could affect this liver. All right. So one is a virus. Two is excess alcohol intake. Three are drugs. Now, on that virus, you have hepatitis A, B, C, D, E. Then under alcohol, you have excessive alcohol intake. Under medications, there are certain medications that one should take because you know that a lot of functions the liver does for human beings. So the liver also functions, help with digestion, detoxification, excretion, even secretion of hormones. So many things the liver does. So in terms of the drug-induced hepatitis, so these medications, once they become excess, they become toxic. So when they become toxic, the liver now begins to have difficulties properly excreting them or reducing them or to detoxify them. So in the process, the liver also gets inflamed. So that's why you have hepatitis from drug-induced from medications.
Oh, so how long does hepatitis live in the body of a human being? So now we'll take it back to viral hepatitis. Then maybe we could also talk about the general hepatitis as well. But how long? What's its lifespan in the body?
Okay, so that means you're talking about viral hepatitis.
Yes.
Because hepatitis is already a disease entity that the body would have due to other causative agents. So for viral hepatitis, most of them are treatable. So when we talk about treatable, meaning you could manage them. Some of them are not curable. So when I mean curable, they cannot be completely erased from the body.
Oh.
Okay. Then some of them also, as well, you could be immunized against them.
Some. So not all?
No, not all.
Oh.
Not all. Okay, so for how long it stays, that's what we call incubation period. So incubation period meaning from the time of exposure till the time of the manifestation of the disease. Like when you start seeing signs and symptoms of hepatitis. So for the virus, hepatitis B stays quite, the incubation period is longer. So meaning you could be exposed now and you wouldn't know you have hepatitis. You've been infected. You wouldn't know for even as long as 3 months, 90 days to 120 days, is the incubation period. Then after that, after the incubation period, meaning the virus has taken its hold on the body, then the symptoms begin to manifest. So it could take as long as 90 days to 120 days before you see signs and symptoms. For hepatitis A is more of an acute infection. So when we say acute, so it comes, everything is faster. So as much as short as 1 week, or even less than that, you could see manifestation already of the signs and symptoms of hepatitis A. Hepatitis C still takes quite a long time also. You could see as short as weeks to months before the signs and symptoms exactly begin to show up. So hepatitis A and E, the incubation period is very short. So you know, okay, you could even probably trace back, this is where I got it from, because it's maybe some days or 1 week, something like that. But hepatitis B or C, you might have gotten it like 3 months ago. And
might have forgotten.
Yeah, you forget that. So you're just like, oh, so how did I get this? Where? Yeah. So that's it.
Now, we're going to talk about the signs and symptoms, but we need to go on a short break now. When we return, we'll discuss the signs and symptoms of hepatitis, viral hepatitis. Do stay with us.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we will realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite. This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television Star Times Channel 127, Free TV Channel 507, and UHF Channel 38.
Welcome back, and thank you for staying with us. This is still Health and Wellbeing on ASO Television, and we have been discussing viral hepatitis with Dr. Chike. So before we went on the break, I said we're going to talk about some of the signs and symptoms that one would see to determine if he or she has hepatitis. So what are the signs and symptoms?
Okay, so for hepatitis, you know, it primarily affects the liver, so especially the viral hepatitis. So what you see for the signs, you could see what we call jaundice, so meaning yellowish discoloration of the eyes, so the white of the eye. So instead of being white, it turns yellow. So you could look at a person in the eyes and you're like, oh, your eyes are yellow. What's happening? So as well as the skin, that could be yellowish discoloration. I'm not talking
like just patches or something.
No, not really patches. Like once you stretch the skin, you could see like there's some yellow pigmentation, not the patches, like a discoloration properly, yellow. Not the white man or something. I say this guy is yellow, but you would know. Okay, basically clinicians and doctors could detect that. Then as well as you might have abdominal pain. I meant to say, so abdominal pain, then abdominal distension. So the abdomen becomes enlarged. The abdomen becomes bigger than normal. So these are the signs. You could also have changes in color of your urination, and all that too, as well as your stool.
Oh, okay. So you started talking about how viral hepatitis can be treated, and you said not all can be treated, and I'm like, whoa. So what happens to someone that has contracted hepatitis that cannot be treated? So I'd like you to tell us hepatitis that can be treated, and what can be done to people that have contracted hepatitis that cannot be treated.
Okay, so let's rephrase that. I said all hepatitis can be treated. Some are not curable.
Curable, okay.
Okay, so hepatitis A, B, C, D, E can be treated. So, however, there's some that really cannot be curable. Hepatitis A is more direct. It could be treated and it could really be cured, like it leaves the body. However, the main issue is at the hepatitis B and C, because these hepatitis are chronic, meaning they take a long time, and they would most of the time they do not leave the body. However, of course, you see some of those adverts where they say, oh, we could cure hepatitis. Well, it's not yet proven, fully
curable.
Like, so, but what we know is that it's not curable. You still would have the antigen or the antibody anyways in your bloodstream.
You may not necessarily show signs.
Yeah, you may not necessarily show signs or symptoms anymore because you've been treated, and you may not necessarily progress anymore to death, but you would still.
But does that in any way affect you?
Well, I don't think anyone that has hepatitis B or any of the hepatitis that has been treated, it shouldn't affect the person, but maybe the emotional, some people are particular about their body, so they're like, oh, you mean I have this? So maybe they're just emotionally unstable, and maybe they might be worried because of the chances of transmitting it to the next person, irrespective of the fact that they are now fine.
Well, now let's talk about eliminating hepatitis in Nigeria.
Okay.
Now, it sounds so contradictory when we say there's stuff that could not be totally curable, and we're thinking of eliminating this. How can we do that? Yeah,
so it's not curable, but it actually can be eliminated. So that's where the vaccine comes in. So it's not curable, right? So let's prevent it.